Good morning. Welcome. And it is yours now.
Thank you so much, Paula. Good morning and good morning, everyone. And I'm so pleased and honored again to be back in Avenidas discussion. Thank you so much. We had a great series of the town hall meetings last year in the middle of the fever of pandemic, when we had a massive outbreak and a lot of mortality, and a lot of the outbreaks happen at that time in our community. And I believe that your group, Paula, you guys have done a great job to, again, putting this information together and bringing for people that at that time, when we were in the middle of lockdown in our state of California and nationally as well. But that was extremely helpful as far as I got a feedback from many of the audiences as well. I just again pleased to be back. Talk about new outbreaks of new mutations of especially what we talk about Omicron these days in our area nationally and worldwide. Why this has happened? Why we are facing that? And that's very important to talk about it. Before I wanted to talk about anything about COVID, we were just chatting with Paula prior to starting these sessions. And as you probably remember, I mean, we had yearly caregiver conference through the Avenidas. And every year, if I was invited, or any other speakers, I believe that they also have the same messages, that we talk about that how important it is for healthy aging to have a social interaction, to have more engaged in like daily activities and be with the people. And I just always make this an example in my lectures, sitting with people, having chat, making as always a sentence that even like live like in other cultures, like Italian cultures, Middle Eastern cultures, sitting together on the table, talk, conversation, having meal together, having a cup of coffee together. These are so important for healthy aging. Brain functions better, body functions better. When we are in isolation, everything's going to start to break down, and we know it by science. What happened, which is, again, I hope that this never happened, because the COVID was a very painful teacher for us. The COVID made that we lost 500,000 of people in this country because of this infection. The COVID made a huge worldwide mortality. But on the other side, when we talk about COVID, that rough and difficult teacher taught us a very, very valuable lessons, lots of valuable lessons that, as I said in my previous discussion, that we never ever able to learn before COVID, because we were being all impressed by science, medical science, and many other things. And we were all thinking about that everything's going to have an answer through the either very, very advanced diagnostic tools or therapeutic tools. But in reality, it's just the talking about mind-body connection. Can we have it through the technology? Of course, there's a lot of things in technology can help us. But in reality, if you want to bring this together, this is our job. This is your job. This is my job. This is every single person. When you think about your own life as a healthy aging, we should provide. And COVID taught us that how important, when we talk about, it is important that we have social interaction with each other. It is important that we're able to sit on the table and talk to each other, because isolation for these 2 years, we learned through that how difficult it will be for mental health and even physical health. I have to say, as a geriatrician, what I observed for the last 2 years, that majority of my patients that we all have been through this pandemic together. But because I'm a geriatrician, I see most of older adult people. I can say, is my observation is, majority of my patients, they decline much faster than I was expected. Even in their chronic diseases, if they have like diabetes, kidney diseases, heart problem is just got worse in the last 2 years, not because they didn't have access to the medical centers, no, because exactly what we talked, mind and body connection to each other. When we are isolated, we have more depression, we have more anxiety, and that affects our physical health. COVID taught us that this is true. No, it was very painful. And now I think, which I always saying in my lectures as well, the medicine will be divided as of now to pre-COVID and post-COVID era. And I believe that after this pandemic, and after we have a better control of this pandemic and infection, a lot of the items, a lot of criteria, a lot of discussion about medicine will be different after COVID. And I think one of the other things that we're going to discuss, especially in my job, is healthy aging after COVID and what we learned through the COVID and how we can use it in the future. Now, these are more expertise of Paula and her team, and she can help you with that. But let's just, again, today is a free conversation today. It's just, I'm here to answer some of the probably the most relevant questions that you have regarding what's going on in the community, what should we do, how we can help ourselves, and why we're facing another outbreak as well. Now, first thing I want to say that we talk about it in the past, that we're not surprised that SARS-CoV-2, which we call it COVID-19 because it happened on December 2019 in Asia, and then it starts to become outbreak and then becomes pandemic for the last 2 years of the life. SARS-CoV-2 and many other RNA viruses, they will mutate, and we're not surprised that why we see more mutations, as we discussed even a year ago, we are expecting to see more mutations. Now, it's a concern about is it something that we need to worry about it? Is it something that it happens? No, think about it as a new virus, which is the only 2 years old right now, and it hasn't exposed to an entire population in this planet. And as this virus going to go see a new gene, new people, new environment, definitely this RNA virus is going to mutate to the different shape. And this is very common. I mean, even with the flu virus, as we discussed, we have a lot of mutations every year. This is why when you have your flu vaccine every year, they have to give you every year. And each flu vaccine that you get every year is contained of the mutations that it was happened a year ago. That's why you go to your doctor or your pharmacy and you get your annual flu shot every year. That's why this is going to be a situation that we are going to see more mutations of not only SARS-CoV-2, but also other RNA viruses, especially flu viruses. Some years, we may going to see more virulent viruses, and it is going to be more deadly. It's going to have, which we had it with flu virus. As you probably remember, just 5 years ago, 2017, we had 2017, 18, especially toward 2017, we had a massive outbreak of the flu at that time. And it was deadly. Even a lot of people, even they got flu vaccine at that time, they hospitalized. We had a lot of mortality in children at that 2017-18, and even more in the country. And that happened. What happened is the flu got a mutation. They call it Australian flu or something like that. But again, it's just we live in the small world right now. Is a globalization. You can easily get into the airplane and in 13 hours from one side of the planet comes to the other side of the earth. And that's why you are from one continent to another continent. It's just the 10 to 13 hours. And then technically, if you have a virus and you come to the new environment with the new climate and new people, this virus is going to mutate and either become more virulent or become less virulent. Now, what we see in the SARS-CoV-2, the initial one that we had a lot of the mutations from the last year. Some of them, as you probably remember, as of last year, the one that was a prominent, not the one prior to Delta, it was Alpha, which is the B117, or we call UK version from United Kingdom. That was kind of like a mutation that has a very massive outbreak and also hospitalization as well, kind of like a 12 mutations in the S protein, the spike protein or S protein that we have. And then we have South African mutation, which we call beta mutations, and we have gamma mutation. But anyway, the two mutations that we faced from 2021, it was two mutations. One of them was Delta, you probably remember, December 2020, exactly at the same time that we're talking last year, we had a massive outbreak in India for the Delta, which is B161.7.2 mutation. But this is very transmissible compared to the UK version, the Delta. When we have the household, again, infection rate for UK version was 9%, Delta increased it to 13.6. And but the only things about Delta virus, which we remember last year, was higher risk of severe disease and hospitalization compared to the UK version, which we saw it last year. When it comes to Omicron, which is B11529 mutation, and its first time is actually, they found it in Botswana and actually South Africa in November 2021. And then they found everywhere it's actually going on. It's very rapidly contagious. It's technically, it's as of December became a new dominant mutations all around the world. And as far as like this virus is, one of the things is definitely is more contagious compared to even the Delta. And like, for example, if we have household rate of the Omicron, if somebody has the Omicron, is much higher chance that the households getting infection, even compared to Alpha and Delta variant as well, is highly air transmissible. It goes quickly to the air. One person can quickly infect 15 people in a closed area. As we see that for the last 8 weeks in our skilled nursing home in our area, majority of our staff, they all got infected. They're not sick, they got infected. Some of them are sick, they have some symptoms. Some of them they only asymptomatic. But one of the things about Omicron is it's able to escape what we call humoral immunity, which you build up with the antibody through the vaccine, and able to still, even you're vaccinated, is still to make you to become infected. There's a difference between infected or severe disease. When you can get Omicron and you can have a positive case, your test will be positive, but you have a mild symptom. This is what we observe with Omicron. It's something that we suggest, the data suggests that the risk of the severe disease with Omicron infection is less than UK version and Delta version. And we have, like, for example, we observe in South Africa, which is the first started the surge of this infection, the rate of hospital death was much less than compared to Delta, like 1 versus, I believe, 4.5%. It happened during the Omicron. And again, a lot of analysis has been done in Europe. Like in England, they've done analysis in the hospital to see if Omicron versus the Delta, and they found that Omicron is definitely cause a less severe symptoms. What I personally observed since Christmas, when I got the first call that our staff start to become positive or residents become positive, that definitely the cases that I've seen for the last, I will say 2 to 3 weeks, that definitely there are less symptomatic, majority of them asymptomatic. Some of them, they have some mild symptoms of like exactly like a cold. Runny nose, it's one of the major signs that I've seen in my patient. And the only symptoms that is really bothering them is a cough. Cough, it can be bad in some of the patient in the last 2 to 3 weeks. And even they're all fully vaccinated and even they got boosted, they have some of them symptoms. But I mean, luckily we haven't had any major mortality. We have some, but it's not severe. I mean, I personally have some of my patients, they died, but because of a very severe cough caused a bad respiratory distress. And again, it's very elderly with a lot of other multiple medical comorbidity. The decision was just only comfort care, and it passed away from even the Omicron situation in the last 2 to 3 days. But again, compare of what I've observed last year and what I was taking care of, it's a really mild situation. But there's a problem with Omicron, because when Omicron is happening, a lot of, first of all, psychologically, it affects entire system. A lot of a staffing issue, as you probably hear it in the news. In the area that I work, we almost about 50% of our staff, they're all infected. And even they're asymptomatic, they're at home, but they still have to follow the isolation period till they become negative and then able to come back home. As a nationally, is a huge shortage of the staff. Psychologically, also, it's affected a lot of people because everybody's worried this is not the end of the situation, because everybody is expecting that after Thanksgiving this year, we are going to have a different life. And now this outbreak is happening. Is it something that's going to happen in the future? I believe not. I think that what I believe, and also what I hear from the majority of epidemiologists, we may gonna see less and less virulent of the mutations in the future. We may gonna see a peak of the virulent one up and down. It really depends how we're able to protect ourselves. How is the vaccinations gonna go? How is the future booster vaccines able to cover more, mutations in the future? That's why we may facing in and out a still positive COVID, but not in this situation that we have a massive outbreak. Please remember, if we have an outbreak of the flu, we have the same. If we have 50% of our staff positive for flu infection, influenza, technically, we're going to have the same problem that we have so far. And that's why it's just going to be the situation we have. But one thing that we have observed, at least for the last weeks, the people having the booster vaccine, which is one of the things that is just so important to discuss, is the rule of the booster vaccine. It's a possibility that our immune system, it's wane over time. And this is what we see even in observational study. Like, for example, there's an observational study done in technically in a national database in the United States. They were looking in between March and May 2021 and June to July of the 2021. And they see the rate of immunity against SARS-CoV-2 is dropped from 75% to 53%. That means definitely what we're talking about after 4 months of your second dose of the vaccine, of SARS-CoV-2 vaccine, the rate of effectiveness, it's dropped. And that's why when you boost your immune system, which is nothing new in medicine, you may have in your life tetanus vaccine. As you probably remember, when you go to your doctor, they ask you about a Tdap vaccine, and every 10 years you have to repeat that, because after 10 years, the effect of this vaccine is going to be disappear. Hepatitis vaccine is very famous. We do 0, 1, and 6, and it means 1 at the day, and then 1 month after, and then 6 months. You always historically needs to boosting your vaccine in order to be effective. And this is the same thing for the kids when they have MMR vaccine, measles, mumps, and rubella. They do one of them at the age of 3, 5 years old, and one of them at the age of 7 years old. And then there should be fine. And then the same thing, it's about, but if you don't take the 2 doses of the MMR vaccine, you're not going to have efficacy against measles. When you get second dose, then you're going to be okay for above 90% for the measles, not 100%. That means this has traditionally always been in medicine. We always have to get a booster vaccine. And a lot of the data shows that, like accumulating data, suggests that booster vaccine for COVID is improved the vaccine effectiveness, at least in the short term. And that it's one of the things that I was reviewing was unpublished trial that was observed to ACIP, the Advisory Committee for Immunization Practices by manufacturing. And it shows the 10,000 participants who completed the primary series of their Pfizer-BioNTech vaccine at least 6 months prior to that, and assigned to two groups, placebo group versus the dose that they got the booster vaccine. It shows the effectiveness of booster vaccine against the COVID from 1 week through the 2 months after the dose was 95%. And only 2 severe cases have happened, and both the severe cases happen in placebo, the group that they have no vaccine. But there's another question, is that even we observe the people that are not getting booster vaccine, they still have some sort of immunity to not get a severe disease and be hospitalized. That means having the booster vaccine, it would be wonderful, because what I observe even in my population in skilled nursing home, the one that they have a booster vaccine, majority of them, they've been extremely asymptomatic, or they have a very, very mild symptoms, but none of them been hospitalized, none of them been have a severe disease, none of them requires to have a high oxygen rate, or they need a medication or something like that. That's why definitely having the booster. Now, a lot of observational study has been done. You probably hear in Israel, they had a 4 million of vaccination of booster, and they found that a rate of hospitalization, rate of mortality has been significantly dropped. As you probably hear in the news, a lot of people think about the 4th booster as well, because they're thinking about the efficacy of the booster. Again, it's going to go down after 2 months. And that's why probably there's going to be a new booster. It's coming in month of March. And that's why something that now is a discussion is another booster vaccine to cover some of the new mutations. These are the principles. Now, the other things about I wanted to, before I go to questions, it's about the testing situation and masking situation. Regarding masking, I just wanted to tell you that masking is a very, very important part to protect other people. When you put the face mask or regular face mask, that helps the other people to be protected, because you still can have drops, especially from your nose and mouth, that actually can infect other people. Think about, you go to a store and you don't have a mask and you carry the virus. And if you are sick, like you are in a store, you can cough, and the droplet from your mouth can go to other stuff in the store, and somebody else can touch it. And then that person's hands can touch the face, eyes, and mouth, and they can get infection. Technically, when you're masking, you're protecting other people, and that's going to be extremely helpful. This is why even in the past, we were telling the people that when you go to the clinic or doctor's office, if you're sick, there's a mask there, gel your hand, put the mask to protect other people. I think that's going to be a new norm, new culture, new things that everybody's going to follow that. In the past, the people never followed that. And I think now people become more sensitive. If somebody is a co-worker is sick and there's coughing, they're going to ask, well, would you please go put the mask on your face, because then you may sick other people. No, I think that now entire world, they understand about viruses, that they can be extremely contagious, transmissible, and airborne, and they can actually infect other people. And it's so important that everybody be respectful to other people and make sure if you're sick, even cold, even rhinovirus, even flu viruses, you're able to protect other people. But for protecting yourself, still masking can be helpful if 2 persons at the same time have masks. The only issue is that not the regular mask can protect you against Omicron, because Omicron, based on the mutation it has, is extremely contagious and with a very high R0. That means that if you are having a regular face mask and somebody's close to you, also even the masking, it's still a high possibility that you can get this virus, unless if you have N95 mask, not KN95 mask, which is like a medical N95 mask. But again, it's just living with N95 mask is going to be hard. As a person that has to put a N95 mask for many hours, which is absolutely abnormal and non-healthy, it's not an easy way to be on a N95 mask for many hours. It causes a lot of other health issues if you stay prolonged on the N95 mask. And again, for the short period, yes, it's helpful if you are still needs to be exposed with other people. And if you think that you have some underlying disease, that getting the virus may be extremely, again, dangerous for you, then you probably have to do a stronger mask. And the other things about a face shield that it is helpful. One of the reasons for face shield, one of the area that actually get the droplet is actually going to be around the eyes, eyebrow, and this area, which again, if somebody coughing and droplet to your face, at least with the face shield, you're able to protect. It's so important when you have your face shield, before you put it down, to clean it up with wipe and not touching your face shield. And again, touch your mask. It's so important when you have your face shield. I have my face shield on the underside, but when you remove your face, think about this is my face shield. The biggest mistake, if I remove it and I touch it, and then I touch my mask and my face, then you technically is not doing anything. When you have your face shield, you have to make sure you remove it, you have the wipe or a spray, clean it, and then touch your mask and touch your face, because a tons of virus and can stay on your face shield. But yeah, it can be very helpful if you have to go to a closed area, sitting with other people. Having the face shield, it would be good for the protecting your droplet as well. The other things about testing and the testing will be is still a lot of people ask about rapid tests. The rapid test is still effective, and I can tell you for sure that in what we have seen, one of the things is about the Omicron mutation variant is there is a part in a spike protein is not there, and that's why sometimes the inability of the molecular SARS-CoV-2 tests to detect this S gene. And but majority of the molecular tests, even the rapid tests, are still able to detect the viral RNA, and because they are employ more than one gene target, and that's why we don't have a false negative. However, it really depends on the technique of the test to do the false negative test in rapid tests. Like for example, the major famous one, which is the rapid home test or Abbott test that they're selling, and if I don't think that there's available in the stores. It's a way that we're collecting. That's the things that I've noticed a lot of people do mistake. If you're able to collect very well, which is 10 to 15 times very well, dipping in the nose, rotating, and then to the card, and 3 times clockwise, make sure you put 6 drops in the small hole, and then you close it and do not move it. It will turn positive. I can tell you that for all the patients that we had, if you collected appropriately, it will turn positive, and it was positive. And when we did the PCR, it turned positive as well. That's why it is so important to how to do tests, but I can tell you that rapid test is still a valuable test, even right now. If you have a rapid test, it's a good thing to have. But if somebody is positive on rapid test, then it's definitely positive. There's no good, you don't need to do PCR. Is the positive, it means positive. If somebody is symptomatic and is negative, but the symptoms is very highly suspicious of Omicron, and we see the negative, then this is the time, then we just say, repeat the rapid test or do the PCR, because the symptoms are very suspicious of a possibility of false negative. But as far as I can tell you for sure, if you have a rapid test and it still can be valuable to detecting the Omicron variant as well, and it can be helpful. But one of the things a lot of people, a lot of my patients ask me these questions about, should we be careful as far as like family come and visit? And my answer to them is absolutely yes. We are in the middle of the peak of Omicron right now in the community. And and I believe, and a lot of epidemiologists locally believe, that in the 2 weeks, the curve will go down because a lot of people are getting infections right now. Think about 1 million people in America every day that are getting this infection. Now, it is a high possibility in the 2 weeks, the curve will go down and the situation is going to be better. But definitely my advice to my own patient is for the next 2 weeks, try to avoid any social gathering. If you are going to stores that they are so crowded, make sure that you have a good protection. Especially like, for example, in a store, you have to spend a long time in the stores. If you can still do delivery to your home, I actually suggest to some of my patients, they do it, especially some of my patients, which I know they have some underlying disease, and even their booster vaccine, I don't want them to catch the infections, even I know that they may end up asymptomatic. But I still recommend if you have an opportunity to avoid going to the crowd of the stores, the crowded gathering, try to avoid it as much as you can, and wait for the next 2 weeks. This is January 14. I believe the 4th week of January, the situation will go down. And then probably in the 1st week of February, we have a totally different conversation. It's just going to be much better. And you're able to back again to the life that you had in month of October, November. Possibility that is going to be another booster vaccine after March. And again, having the booster or not having the booster, I don't know anything about it. It all depends on epidemiologists to see how important it is. They are doing a study even for the people that got a booster right now to see how long even the effective booster vaccine is going to be effective. There's other theories there that if you do booster too much in the short interval, the immune system can go to sleep mode and is not going to be effective, and actually paradoxically will be worse. These are questions will be answered in the next 2 months when we have more data available. I'm going to stop here. I think I see a lot of questions here that the people ask, and I wanted to answer these questions on time. One of the questions, Mike, I believe, asked that, do we expect that RNA type vaccine for flu will be more effective than the dead virus vaccine that we're currently getting each year? Yes, the answer is right, absolutely. This is exactly what some of the scientists is actually working on and that's a possibility. Again, the RNA vaccine, RNA treatment vaccine is nothing new. It's been over 20, 30 years that they're working on that. And even in oncology and cancer treatment, the RNA treatment being there. Having RNA vaccine is new, but again, is nothing that's been new and completely new. But yes, it is absolutely expected that the flu vaccination may also evolve in the next years. So far, what we have, even with the traditional inactivated virus with the influenza, we're able to control the mortality worldwide. I mean, since we have the pandemic of the Spanish flu in 1928 till today, we haven't had a major mortality worldwide with the flu. But again, influenza virus, it's a very scary virus. I'm still, as a geriatrician, I'm so scared of influenza virus. I mean, believe me, it can act crazy and it can make a lot of issues. But the things about influenza virus is majority of the people in the world, they've already been exposed to this virus. That means that technically this virus experienced different genes, different, environments, different climate. And it seems that even with the current science on inactivated virus, which we are getting majority of time, majority of all the 3, 4, 5 kind of virus vaccines of flu that we use it every year, they are effective against severe disease and hospitalization. Again, the biggest question, before the COVID, I always answer my patients that I still get flu when I get in flu vaccine. The answer is yes, you still can get flu, but if you have flu vaccine, the rate of hospitalization is less. The chance that you end up to ICU is less. And that was completely approved and observed by even a study, even in the kids, when they have flu vaccine, the rate of ICU admission is less compared to the one they don't have that. That's why, again, you may gonna still get COVID, even you have booster. We may repeat the booster every 6 months, 4 months. I don't know the answer. I'm not expert in this field, but we still may able get the COVID, but will be asymptomatic or mild diseases. And if the mutation, one of the other questions Mike asked, if the mutation will be less deadly than the previous one. This is the dream and hope for all of us. It really depends how this virus is going to act. Is this virus going to act to be less virulent mutation? That will be a wonderful news for human. And that time we can celebrate that, yes, then we are, that happened. Now, remember, in 2012, the SARS-CoV happened in Middle Eastern area, in Egypt and Saudi Arabia, called MERS. It was big killer. They're thinking about it comes from bat to camel and camel to human. And in these two countries, it's quickly had an outbreak and quickly the virus by itself mitigated and contained. Did we do anything? No, the virus did it by itself. And because one of the reasons is, again, it just at that area happened, it didn't go to anywhere else in the world, and it stopped by itself because the next mutations was less deadly, and finally, we haven't seen any MERS so far from 2012. Now we are in 2022, in the last 10 years. But that one is much more deadlier than what we are facing today. Now, we were so lucky that this thing happened naturally. Now, if that's going to happen in the future with the SARS-CoV-2 or what we're facing, that's going to be the bonus, and that's why something that we know that. And compare of the natural immunity versus vaccine immunity. The natural immunity against the virus, like for example, if you get infection, it's very short period. The same thing for all RNA viruses. Like if you get influenza that year, it doesn't mean that you're not going to get influenza again. It's a short period of time. Yes, for 1 month or 2 months you are. We see the people who got the COVID, at least we don't know anything about Omicron. We still have to see how long they're going to be immune against Omicron. But what we see in the previous version of the COVID-19 is technically they give them immunity for 2 to 3 months. Some cases may extend to 5 months, but not more. Not everybody got the immunity for a year or two. No, the people got the infections in March 2020. If they haven't been vaccinated, they have no antibody against the COVID right now in their body. They don't. And that's why even done in multiple study to see the quantitative IgG against the COVID. And the answer is no. Then technically, even if you got the Omicron right now, it doesn't mean that if I get Omicron today, which I think every day I'm getting it because I'm exposed to many patients, but it doesn't mean that it's going to last till March or April. I still have in April or March, if there's a new mutation, if the new Omicron, I still can get it and I still can be infected with that. That's why, again, we still have the, I think I answered the question about the face shield, which again, it is helpful. I still think about it. How long should we quarantine if you're positive? Great question. No, the lot of the things has been changed with Omicron because of the virulent and the disease. Now, the one we do for healthcare providers, like let me ask, and I can tell you about that. The situation is that if you are infected, if you are tested positive, and you are asymptomatic, or your symptoms are very mild or getting better, after 10 days, you are not contagious at all. That means you can be out of isolation and you can be out of that. If that happened, just count 10 days. No, if you want to do test protocol, if you get infection and you are asymptomatic or have very mild symptoms, no fever for the last 24 hours, you're doing okay. After 5 days, you can test again. And if your test negative, rapid test negative, you can be out of isolation. But you just have to make sure you have a face mask and everything to complete that 10 days to make sure the other people, but you can go out of the isolation. You can go to the grocery store. You can go to the place. 5 days, not 3 days, 5 days. And don't forget that. Now, this is based on what we call in California, there's a lot of the different variety, like CDC recommending 7 to 10 days, and some other places 14 days. For a skilled nursing home and for assisted living facility, we still put the people, if they're infected, we still think about 14 days. Now, this is the California Department of Health. It's a lot of confusion these days, but I make it easy for all my patients, all my staff. Again, if you are infected and you have no symptoms, think about 10 days. You don't need to test again. Even your test is positive after 10 days, you're not contagious anymore. You still can be positive. You have some dead viruses in your nose. You can be positive. 10 days, think about it, and you're fine. You can go out. If you don't have a symptom, if you are symptomatic, and if your symptoms is not getting better, you have to wait for 14 days till to complete the 2 weeks course. But it's less likely the Omicron, we're going to see this. No, but if you really need to out of isolation, I will say 5 days. Do the test at 5 days. If your test is negative, be out of isolation. Just make sure you wear your mask, which you have to wear your mask anyway, and you can be out of that. And that's why it is, that's a protocol. Now, the healthcare workers, there's a huge shortage of staff. And for the ones that are fully vaccinated, if they are positive, they just let them to work in the positive area. Like, for example, in the skilled nursing home, last week when we had a lot of positive, we just say, okay, well, what should we do? We have a lot of healthcare workers, they're positive. Let them to work in the positive area that they have cases positive, but they don't take care of the people that are negative. We use them and we've been successfully be able to do that. But the answer is, if your healthcare workers are positive, they're not allowed to work in any clinic. They have to wait for 5 days, and they need to be tested at day 5. And if they're negative, they're able to come back. I can tell you for sure, in the area that we are living, all the institute, they are following that direction. If they are positive, if they're infected, it's different between exposure. Exposure is different with infection. If they are infected and they're test positive, they have to be in isolation for 5 days. At day 5, they will test them. If they're negative, they can come back to work. If they are not negative, they have to wait for 10 days. And after 10 days, they can come back to work. And they don't need tests anymore if they have no symptoms. If they are exposed, but they're not test positive, if they are fully vaccinated, like myself, I'm fully vaccinated, I got my booster, and I exposed a lot for the last 2 weeks. Okay, now what Mehrdad Ayati needs to do? According to the new guideline, because I'm fully vaccinated, but I'm exposed, I don't need to be isolated. I just need to test on day 1 and day 5 and continue testing, which again, in my case, they test me every day because I'm a super exposed man. But technically, I'm testing every day, and every morning before I start my work, before I'm getting out, I test myself, and I also test. They also test me. Technically, I test twice, and then and if I'm negative, then I'm going to start to see the patients and be in community. But the same situation because I'm fully vaccinated. If the healthcare worker or you yourself are not fully vaccinated, what does it mean? I'm not fully vaccinated means you got your 2 doses. But it's more than 6 months from your last second dose, or you didn't get your booster, you consider unvaccinated. You need to be, if you're exposed, you need to be in isolation, and you need to test again, and at day 1 and day 5. And if you're negative, then you can be out of your isolation. But definitely, if somebody only got the 2 doses, but is more than 6 months and hasn't got the booster, if they're exposed to someone who's positive, they need to keep themselves in the isolation. The rapid tests, many of them, I see the questions that they are expired. That's true, that many of them expired. Now, the CDPH and county may not like it that I say that, but I have to tell you, as I hear from many of my colleagues, they're scientists and biochemists, and it does not matter. It's still working. The reagent is still working, and expiration is the one that they did it with quality, but even for a year, you can use it. That's why even if you have with the expiration date, it's still effective. We actually seen that in many of our skilled nursing home patients. We use the expired one as experiment, and they see, yes, it's still showing positive cases. and positive things about that. And with the social contact being vital for healthy aging, what do you recommend for techniques of social connection when we are in the mode of isolation? Hopefully, that's very important. I think we talked about in the past. I think now, for years, we're talking about exactly the way now I'm connecting to you, using technology and learning about technology, how to connect to each other. I highly encourage my patients to use any technology or families through the all meeting situation, FaceTime, definitely having the conversation, not sitting and only watching TV and not only watching the news, which is always not very helpful way to deal and hear, and it makes you sometimes more depressed. But definitely having your friends and group and having the conversation. Again, a lot of the national things is happening. A lot of people, like for example, start to reading book and they make like a small group and they talk about that book, they talk about that article. I've seen in other states, some of the seniors, they're doing some small group gathering data. Like for example, they said, I'm going to gather the data about a booster or where we can go shopping and all this stuff, and they can do a small group and connecting to each other. It is very important. And I think the reason I believe that we're able to survive in this pandemic is about technology. That's exactly because it happened in 21st century and we able globally to survive. And that technology has helped us a lot. And if we didn't have it, it was been extremely painful. And that's why it's still, my feeling is, my strong feeling is a spring will be totally different environment. And then the lots of doors will be open. You guys can again see each other again, Avenidas and many other places. But I still think about that even in the worst case scenario, if we have the situation, if we have to go to isolation, we should have a path, we should have a program, what we need to do. And I think the other question is, Miriam asked me, swab throat before a nostril with home test. It does not matter. No, it doesn't matter. It's just if you just nose again swabbing, it still can be positive as well. 2-layer of the cloth mask versus the paper surgical mask. Definitely 2 layers is always better than 1 layer. There's no question. It's just, again, think about physics and also that you actually protect more. And then the question about KN95, it's really not, the KN95 is not protecting you against the virus. But it's the nice thing about KN95 is protecting your air, the nose and mouth better than the regular surgical mask. But honestly, if you have KN95 and you're exposed to someone with Omicron, you can get it easily, unless if you have N95. And that's why, again, it's a good mask. I really like it. Like, for example, if you wanted to just protect other people because it's covered very well, but it's just not a fully protection with KN95. And but it still is much better than face and surgical mask if you don't have a 95 mask. And again, my suggestion is that while we are in the facing of the middle of the surge of Omicron, try to avoid any interaction with other people. And that's why you don't need to have a N95 mask. If you can do shopping online, if you can get this stuff, if you can avoid the people at this situation, will be better. And again, please, Paula asked, please remind us the way differentiate confusion due to flu, dehydration, UTI, and early onset dementia. What should relative do if are only concerned their loved one is having cognitive decline and radical change in behavior? Actually, well, that's a very good question. That's actually interesting, and one of the things is whenever we have a change in a status, like for example, we have dehydration, especially dehydration, I see, or viral infection, as Paula says in the comments, UTI, pneumonia, we always see a change of the status of the behavioral symptoms and also cognitive function. That's what we call delirium. Delirium, especially for the one that they have dementia or they don't have dementia, is always the other side of the flip of dementia, which is acute confusion. And that acute confusion happens because the brain has a hard time to able to putting everything together when there is a changes happen. Like for example, when we are younger and we get like a flu, I mean, we get a flu, we go isolate ourselves and we just drink water and taking Tylenol. But when we have cognitive decline, we get any change like a flu or something, our brain gets more of a struggle, and we have a hard time to understand, I just got a cold and flu, because the frontal lobe is not working very well. And this is why we have a different manifestation. And sometimes you get surprised that how an older adult person with dementia, with the UTI or flu, urinary tract infection or flu, they have agitation, they are aggressive, they become paranoid, they become extremely paranoid, and even they become delusional, they become hallucinating. And you always question, why hallucination? What's wrong with this urine infection? What's wrong with the urine, with the hallucination? But that's absolutely true. Anytime we see acute change happen to the body, we see a huge manifestation of differential of all kind of like a behavioral disturbances, including agitation, hallucination, and many other symptoms, which the same thing we've seen in Omicron. The cases that we have with Omicron, when they got it, if they are demented, they have more delusion, they have more paranoia, some of them because agitated, even we don't see any runny nose, cough, and any other thing. All we need to do is supportive care, hydrate them as much as we can, and try to calm them down. And any tips about how to navigate concern about safety in care facilities? Should they worry about the staff to patient? Well, it is a worrisome. I have to tell you that, especially it's been worrisome last week. Luckily this week, majority of the staff in some of the facilities are positive. They are graduating from isolation, and I'm happy about that. I get the news this morning, some of them are coming back, their tests are negative, but it was extremely painful. And again, some of the facilities right now here as of today, they're facing the staff are turning positive. Yes, there is a concern. As I told you, this week and next week, it will be extreme week for us and in all facilities. But so far, as far as I hear from the community, again, even I'm not involved directly, but the community share with me their news. They're able to navigate between the staff that are not positive and try to make sure that the care will be provided for the residents as well. And that's something that I can tell you. But again, as far as we know, the staff, none of them are sick like last year. We had many staff that have been extremely sick, some of them hospitalized. This is not the case. The staff, their booster vaccine, the majority of them, they got their booster, they're doing well. They only have asymptomatic positive or mild symptoms, and a lot of them, they're graduating after 5 days when the rapid tests turn negative. Another question is here. I think Paula still asked about alcohol consumption during COVID. It's a good topic. I mean, it's just something that we should probably spending another time. It's the worst things to alcohol consumption. Not only that. I mean, I don't want it to be extreme negative against alcohol, but and I just want to say that year by year, the science is showing to us that alcohol is not healthy for body in any format, in any things, and then again, that's something that I didn't do research about it, and all the scientists they're doing research about it, and they found the alcohol is extremely neurotoxic. The other problem with alcohol, it makes your body to become extremely dehydrated, volumely depleted, and then because alcohol needs water. And when you are dehydrated, when you drink alcohol, you're not able to metabolize alcohol very well. And that's affect your body, affects your muscles, affects the interaction with other medications and many other negative things about. I think it's a very good topic, Paula, that we can discuss in the different time about effects of alcohol to the healthy aging. But I can tell you for sure till now, as again, when I was like 10 years ago, I didn't have this amount of data about negative effect of alcohol on healthy aging. I didn't have because there was not. But in 2022, if I want to have a lecture and presentation about negative effect of alcohol in healthy aging, I have a lot of data right now available worldwide. That's why a lot of scientists, they've done a lot of research and a study and showing that alcohol overall is not healthy for everything. A lot of people think alcohol, drinking red wine is good for memory. That's not right anymore. Having the shot of the scotch or whiskey is good for heart. Or help with the flu and cold. It's not true anymore. It used to be. The people think about that way, and I actually believe it that way. It's, oh, that's good. If I'm sick, I'm going to have a scotch of the a shot of a scotch and help me. But the answer is no. It actually makes you worse because your body and muscles get more dehydrated and you have the more struggle with that. But it's a very good topic, and I'm glad. Sadly, during the COVID, it's a very interesting thing happened. During the COVID, a lot of people started drinking alcohol, but the positiveness that we see, a lot of people for the first time think about that it's important to be healthy. And healthy behavior, it's actually became something that a lot of people now, they're approaching it. Because one of the things we notice, the people are not smoking and not drinking alcohol, they're able to survive much more from the COVID severe disease. That's not observation in the United States. That observation happened globally. Now, this is why I'm telling you that after this pandemic, the medicine will be divided to pre-COVID and post-COVID. And after post-COVID, there's going to be a message for the people around the world that, listen, the people are having less chronic disease, less drinking alcohol, a more healthier behavior in their lifestyle. They even they got COVID, they're able to survive. And that's something that not only happened in the United States, everywhere in the world, they are reporting that. Now, that's probably going to be a new message, even knowing about this pandemic and how our lifestyle can help us to survive from the massive pandemic. Shouldn't we expect that there will be more variants, potentially even more aggressive? That's why I told you, we don't know. It's kind of like a sitting and expecting to see what happens. I'm expecting to be less, especially because a majority of the people in the world will be vaccinated, hopefully in the next couple of years. A lot of people in the country will be vaccinated, boosted as well. It's more likely the virus may not able to be more aggressive. And if we didn't have a vaccine, the answer is probably yes. But no, because we have a vaccine since last year, the answer will be less. What we observe from flu story so far from 1928 pandemic till now, we didn't have another pandemic in influenza. Just remember 1928 to 2022. That's why I'm hoping that with the vaccination around the world, and even this virus is circulating around the world, we're probably going to see variants. We're going to see sometimes some local outbreak, but it's not like this that we see massive outbreak and massive lockdown. It can be other RNA virus coming in the future. Yes, that's always a possibility. I hope not. I hope I don't see it in my life as well, but it's always a possibility that another RNA virus is going to act crazy. But we all should hoping, if we are a believer, pray that this is not going to happen. Thank you so much. I appreciate it being with you all. And I'm living to Paula.
Dr. Ayati, thank you. That was very helpful. And I just want everybody to know this is rather a late, urgent request. We pitched to Dr. Ayati today to come on. I think we asked him maybe a week ago if he'd be willing to come back and talk to us, and he said yes. And he always says yes. And we thank you so much for that.
You're welcome.
And thank you everybody for your questions. Now I'm going to ask really that you stay on, because I think Dr. Ayati's point and one of the questioner's point about what happens next, how do we stay connected, is something that I think about every day. And I really do get calls every day. I'm getting calls from relatives in Missouri, New York, Oregon, who have people here who want to know how we can help them. And so it's something I do think a lot about. And we have a lot of ideas in mind for Avenidas moving forward with more partnerships with Stanford. We had someone in our building yesterday who runs the Stanford Community Engagement Program, and we are brainstorming away on ways to have intergenerational programs here and use this building in a much more comprehensive way for older and younger people and families, and bringing students into our community. So I'm excited actually at this point about what this COVID experience has informed us in the healthcare world and the social service world, and about how we can work together. So Kat is going to set up, and it's my moderator.